When taking Tylenol, be sure to follow the directions on the product package. It's important to read the dosing instructions carefully, as different brands and forms of Tylenol may have different amounts of acetaminophen. Be sure not to take more than the recommended amount to avoid any potential side effects. If you are giving Tylenol to a child, make sure to use a product specifically meant for children and use their weight to find the right dose. If you don't know your child's weight, you can use their age to determine the appropriate dosage. For liquid forms of Tylenol, be sure to shake the medication well before each dose, unless otherwise directed. Use the provided dose measuring spoon or dropper to ensure you have the correct dose, and be careful not to use a household spoon. Depending on the type of Tylenol you have, you may need to chew the tablets thoroughly before swallowing or dissolve effervescent tablets in water before drinking. It's important not to crush or chew extended-release tablets to avoid releasing too much of the drug at once. When using Tylenol for pain, it works best if taken at the first signs of pain. If you wait until the symptoms have worsened, the medication may not be as effective. It's also important to follow the recommended dosage and not to take Tylenol for fever for more than 3 days, or for pain for more than 10 days, 5 days in children, without consulting your doctor. If your condition lasts or gets worse, or if you develop new symptoms, be sure to consult your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience any unusual effects, it's important to contact your doctor or pharmacist right away. Your doctor has determined that the benefits of taking this medication outweigh the risk of side effects for you. While most people do not experience serious side effects, it's important to be aware of the symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Tylenol, it is important to let your doctor or pharmacist know if you are allergic to acetaminophen or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also crucial to inform your doctor or pharmacist about your medical history, particularly if you have liver disease or if you regularly use or abuse alcohol. If you are considering using liquid products, chewable tablets, or dissolving/effervescent tablets and powders, it's important to be aware that these may contain sugar or aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's important to exercise caution and consult your doctor or pharmacist about using these products safely. If you are pregnant, it's important to inform your doctor before using Tylenol, as well as if you are breastfeeding, as acetaminophen can pass into breast milk. It's important to consult your doctor before breastfeeding while using this medication. Remember that the daily dosage and optimal timing of Tylenol should be discussed with your doctor or pharmacist to ensure safe and effective use. When taking Tylenol, it's important to be aware of potential drug interactions. Certain medications like ketoconazole and levoketoconazole may interact with Tylenol, affecting how it works or increasing the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication, always consult with your doctor. Additionally, Tylenol may interfere with certain lab tests, potentially causing false results. It's crucial to inform lab personnel and all your doctors that you are taking Tylenol to ensure accurate test results. If someone has taken too much Tylenol and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 for immediate help. Otherwise, contact a poison control center right away. In the US, residents can dial 1-800-222-1222 to reach their local poison control center, while Canadian residents can call their provincial poison control center. Symptoms of Tylenol overdose may include nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Acetaminophen, commonly known as Tylenol, is a pain reliever that does not cause stomach and intestinal ulcers like other NSAIDs such as aspirin, ibuprofen, and naproxen. However, it does not reduce swelling like NSAIDs do. It is important to consult your doctor to determine if Tylenol is the right medication for you. Tylenol can be used to relieve minor aches and pains, reduce fever, and is commonly used for headaches, muscle aches, backaches, toothaches, and colds. The recommended daily dosage for adults is 4,000 mg, taken every 4 to 6 hours as needed. It is best to take Tylenol with a full glass of water, and it can be taken with or without food. Always follow the instructions on the label or as directed by your doctor to ensure safe and effective use. If you are taking Tylenol on a regular schedule and you forget to take a dose, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When storing Tylenol, it's important to keep it at room temperature and away from light and moisture. Be sure not to store it in the bathroom, and always keep it out of reach of children and pets. If you need to get rid of Tylenol, make sure not to flush it down the toilet or pour it down the drain unless specifically told to do so. When it's expired or you no longer need it, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.